Hi everyone, welcome to week 2, Introduction to Social Work Research. Today we're going over 4 different presentations, chapters 2, 3, and 4, and outlining research articles. Just as a reminder, next week you guys have a discussion board post due by the 23rd, and 2 comments due by our next in-person class session on the 27th. Also on the 27th, you guys have exercise 2 and exercise 3 due. Those should take probably a little longer than exercise 1 did, and there are 2 of them, so please budget accordingly for your time, as well as chapters 7 through 8 that you guys are going to need to read. Just some reminders before we get started on the presentation. If you have questions, please email me. You can also call into Wednesday office hours or come see me after class on Saturdays. Finally, you guys should also keep reading in your area of interest. There are going to be some assignments that will sort of prompt you to do some reading where you can get credit for that reading. But the first half of the semester is really about finding the literature that is going to help you throughout the rest of the semester for your research proposal. So the more that you read, the more that you do, the better positioned you will be to complete the assignments for this class. So also pick something that you actually care about, so that you make sure that your reading is actually something that is going to interest you. So chapter 2, evidence-based practice. I'm sorry for the quality of the scan here, but this is the diagram, and I think it's a helpful diagram for how your book understands what evidence-based practice is. So evidence-based practice is not just figuring out what the literature says to do, but it's also about figuring out what your client is like, their characteristics. You clearly, if you are doing some kind of social work intervention, you must have done some kind of assessment for this person. So figuring out what might work for them, as well as what resources you have. What do you bring to the table? What does the client bring to the table? And then the context in which the practice is actually taking place. So let's work through this with a case example. Let's say you are working with a kid named Connor. He is diagnosed with Williams syndrome. If you don't know what Williams syndrome is, it's an intellectual and developmental disability that some of the symptoms are cardiac and gastrointestinal problems. They tend to have higher levels of anxiety, lower intellectual functioning, and a lack of social inhibition. People with Williams syndrome are very friendly, but they do have some intellectual challenges. And Connor is transitioning from child to adult services. Usually this happens in the early 20s when that person is graduating from high school. Most child services for people with IDD are done via the schools. When you transition to adulthood, that stuff needs to be more community-based. So some of the challenges that come with that transition are, is this person going to be living independently? Are they going to continue living with a family member? Are they going to go into group housing or congregate housing? Are they going to go get a job? Are they going to go into a sheltered workshop? Do they need maybe supportive employment? And then what sort of supports do they need inside of that employment environment? Does that person need medical supports? For somebody with Williams syndrome, they might need some dietary things. They might also need home and vehicle modifications if they develop mobility issues. So how can you use evidence-based practice to inform your decision making? So you should be looking at the available quantitative and qualitative studies. You need to learn more about what Williams syndrome is and what's effective for it, and more about the client problem, which is how do you transition from child to adult services? So you need to look at the available evidence for that. You also need to look at the client population itself. So what is Connor like? What is he like? What does he want to do? You also need to look at what resources that person brings to the table. Do they have a lot of knowledge about themselves? What sort of skills do they have? What's their support system like? And then what sort of resources can you get? What sort of programs exist inside of that state, inside of your locality that might be able to support this person? And then what do you know? What do you bring to the table? And then finally, the context. So what is Connor's family like? Are they supportive of his goals? Are they maybe a little bit more domineering? Are they trying to protect him from making his own decisions? What about your agency? What does your agency normally work with people with this diagnosis? What sort of resources do you guys bring to the table? What is your agency culture? What sort of theories and philosophies for working with this population do you have? And then thinking about sort of the very big macro scale stuff. So what sort of policies exist on a local or state or even national level that might be able to help this person? And then what sort of cultural environment might exist for somebody with an intellectual or developmental disability? And all of that stuff needs to figure into how you actually make decisions and interact with this person. So these steps for using evidence-based practice. So step one begins with formulating a research question to answer your practice needs. So you need to figure out what client characteristics are important, figure out what interventions you might use and what alternatives exist, and what outcomes you are interested in. Now, choosing which outcomes are most important for a client like Connor is kind of important. Is the outcome that you are concerned with whether that person is satisfied with their services, whether they avoid going into a hospital or into a nursing home, and whether they're able to stay inside of the community? Is the outcome that's important whether that person is employed? All of that stuff is going to impact what interventions you end up choosing. Now, last class we went over step two, how to systematically search for evidence using academic databases like Academic Search Complete, PsycInfo, PubMed, Google Scholar. All of those things can help you get the literature on how to intervene with a client like Connor. Next, you need to critically appraise that literature. Part of evidence-based practice is using your critical thinking skills to figure out what evidence makes sense for your client situation. And then you're going to determine which intervention you're going to use, apply it, and then solicit feedback and evaluate whether your intervention actually worked. Some good resources for evidence-based practice include the Cochrane collaboration and the Campbell collaboration. If you are interested in a specific therapeutic technique, or you are interested in a specific social problem, those resources, as well as NREP, will be able to give you a good amount of information on what is known for different interventions for that particular problem. The Cochrane and Campbell collaboration will give you literature reviews on different evidence-based practices. They will put them in language that is hopefully a little bit easier to understand. Their job is to really sort of take a survey of what is known about a given area, and then to try and put that information together in a way that is easily digestible and understandable for practitioners. So there are some controversies with evidence-based practice. Not everybody likes evidence-based practice. One of the things that may be challenging about evidence-based practice is that it's not always the easiest to actually implement. Evidence-based practice might actually be pretty challenging to implement in your area. Maybe your agency does not have enough resources. Maybe your superiors and the people in charge of that agency don't really value evidence-based practice. Or maybe you're working with people who they just don't look like the people who are in research studies. And that leads us into a different sort of challenge with evidence-based practice. Evidence-based practice and research studies in particular often try to focus on clients with simple problems. So a client comes in who has major depressive disorder. This person needs some kind of intervention to deal with that. Unfortunately, as we know as social workers, the clients that we work with are complicated. They have multiple problems, all of which are impacting them at the same time. So I didn't just work with people who had major depressive disorder. I worked with people who had major depressive disorder, a substance use disorder, a history of chronic homelessness, traumatic brain injury, as well as severe complex trauma. Those people are complicated to study. That depression intervention may not work because of this person's trauma history, and that might mess up their study. So evidence-based practice for people with complicated issues is kind of lacking. That doesn't mean that you shouldn't use these things, but that the degree to which you can use evidence-based practice with these people is somewhat limited. And that you should just use the best available evidence that you have to go on. Evidence-based practice is also critiqued as being overly restrictive, that if somebody comes in with this specific problem, you just look at the literature and you see what the literature says to do, and then you do that thing. And from a social work perspective, that really devalues your own professional expertise, which you guys either have developed or will develop over time. Now, this critique has been sort of included into the model of evidence-based practice that exists inside of this textbook. You can see how evidence-based practice over time has really taken the critiques of evidence-based practice and incorporated that into the theory of what evidence-based practice is. So rather than just saying, what does the available evidence say, evidence-based practice also looks at what you know and your own knowledge, as well as what the client knows and their preferences and their knowledge, and all of that stuff is sort of bound up in what evidence-based practice is. Finally, it's seen as a cost-cutting tool that evidence-based practice is just about making sure that insurance companies save money and that it's not really good for the therapeutic alliance. It's just more about just looking at the literature, and really anybody can look at the literature and then do what the literature says. And it really devalues the sort of empathetic relationship that exists between a practitioner and their client. And then finally, I think the most important thing on here is that high quality evidence is scarce. Now, this is true to some degree and not true to some degree. So there are not a lot of randomized controlled trials, which is sort of the gold standard in evidence-based practice for social work interventions. There are a good amount of them for different social work interventions, but inside of the real world, sometimes it's just not feasible to do that. And some of the interventions that you rely on are based on case studies. They're based on maybe one or two small-scale studies. They're maybe just based on intuition and what your agency has done in the past. And that high quality evidence is sometimes just difficult to come by in social work research. All right, I'm going to cut off the video here, and we're going to start the next one with chapter 3.